teenage pregnancies and prenatal care. And I would imagine at General Hospital you have an opportunity to deal quite a bit with that problem. Could you perhaps give us some information relative to that?
Certainly, we do, Dr. Haney. I think that there are several things to keep in mind with regard to teenage pregnancy. One is that we need to take measures as a community to prevent the likelihood of teenage pregnancy. One topic of interest right now is family life education, and we're seeing some movement in Davidson County to have that adopted in our public schools. Other counties of the state are beginning to implement family life education programs. So a little bit more awareness on a broad scale in the schools and in the community about the dangers of teenage pregnancy, and making teens have more access to information about their own sexuality is one way we can prevent teenage pregnancy. Another thing is that if we can get people into health care, as we've emphasized today on your program, into health care early in pregnancy, and then provide good follow-up care for the teenage mother during and after the pregnancy, so she can delay her next pregnancy until an age where she's more ready and more able to have a healthy pregnancy. That's another important factor. And then finally, it's providing not just the health care but also the support to that teenage mother once she does become pregnant. Support in the form of continuing her in school, helping her to stay in school, continuing her education. Support in the form of letting her know that she's not alone, that members of her family, members of her community want to see her and her baby succeed after the birth of a baby to a teenage mother. Helping teenagers encourage other teenagers to delay sexual activity, to wait until they're a little older and a little more able to cope with the complications that can arise from being sexually active. So there are a variety of things involved in the issue of teenage pregnancy that certainly relate to prenatal care and relate to the health of babies and the health of the whole community.
Very good. Over the last 4 or 5 minutes that we have left, I'd like to look at the federal government's role, if there is indeed a role. I think we've talked about the state's effort in terms of the task force, but has the federal government a responsibility in the area of prenatal care, and if so, what is that responsibility, or what are we doing now, or what should we be doing?
Well, that's a good question. The federal government has historically had an important role in maternal and child health and has been one of the major funding sources for programs like Dr. Nevel's and the maternal and infant care program at General Hospital. Over the last 5 to 6 years, we've seen some dwindling of the federal effort in maternal and child health, and the state has in turn picked up its effort. It would be great if we could have not only the Tennessee Healthy Children's Task Force, which the governor and Honey Alexander have been so active in promoting in the last 4 to 5 years, but also a more active federal role in terms of financing, both financing of health care and the financing of specific programs such as family planning, such as prenatal care that can promote the health of mothers and babies. So there is a need for increased support at the federal level and increased emphasis at the federal level. There were some goals set for 1990 back during the Carter administration of targets for low birth weight, targets for infant mortality, and we need to really have those as national goals, and they've kind of fallen off the national agenda a little bit. We need to focus on the health of mothers and babies at all levels, the federal level, the state level, and the local level, and the non-governmental level. Programs such as yours, promoting the need for awareness, are a big part of that.
As a matter of fact, if some of our viewers wanted to get in touch with either of the two of you, how could we reach you?
You can reach the Maternal and Infant Care Program at 259-5767.
I think there's a number on the screen there.
Good, good. And if you should not get an answer, as you won't on the weekend, to just call on Monday morning, Monday through Friday, from about 7 in the morning to about 5 in the afternoon. And we'll be happy to provide information, screening for getting into the program, or referral to other health care programs.
And Dr. Nevel, any?
Well, just one thought. We've covered a lot of areas from a medical perspective. And sometimes when you just mention things, briefly, that kind of scares people and it keeps them from coming in. It's the most important thing I can tell you is that the Department of Health and Environment cares about the citizens of Tennessee. I care. The nurses in the health departments, the clerk, The biggest thing that you can do is, if you have any questions at all, is come into your local health department. If you have a private physician, he or she is going to provide that kind of information. But if you have any doubts whatsoever, come in and talk with us, and we can provide this information. The key point about what we're talking about now is just to make people aware that it's important to come in to receive the prenatal care early in their pregnancy. And then all these other things that we've talked about, we will share with those things with you, with the health educator and the physician and the nurse practitioner. All those things will be dealt with. And certainly forums like this to bring the issues up and make people aware of it, I think is most important.
Mr. McLaughlin, a final comment, and I'll wrap it up.
I would just like to second Dr. Neville's comment, and that is getting into care is important. There are no financial barriers to care now in Tennessee.
That prenatal care is
available and free. And please come
in all regions, in the 5 regions of the state.
That's correct.
We've got people there that can take care of these problems.
Absolutely.
Very good. And we're simply delighted to have the 2 of you with us this evening to talk about what we consider to be a very, very important question in the state of Tennessee, and not only in the state of Tennessee, but throughout the nation. And so in behalf of the staff here at Z17 TV, we'd like to thank you for being with us. And this is Dr. Haney bidding you good night.